Hello everyone. Today we are going to start a chapter of thyroid disorders. Okay, in this chapter we will cover diseases which are caused by the dysfunction of thyroid, its hormones, the gland, and even other glands like the pituitary gland. So let's start today's chapter. The first thing we have here is functional disorder. Okay, two significant functional disorders characterized by distinct clinical syndromes are described. These are hyperthyroidism, thyrotoxicosis, and hypothyroidism. Hyperthyroidism, which is thyrotoxicosis. Hyperthyroidism, also called thyrotoxicosis, is a hypermetabolic clinical and biochemical state caused by excess production of thyroid hormone. The condition is more frequent in females and is associated with rise in both T3 and T4 levels in blood, so the increase in T3 is generally greater than that of T4. Okay. So before we discuss this hyperthyroidism, before that we will see a brief overview of the thyroid. Okay. So the thyroid gland, it releases T3 and T4. T3 is released in lesser quantities and T4 is secreted in greater quantities. T4 is relatively less potent than T3, and these hormones are released due to the function of TSH, which is thyroid stimulating hormone, and it is released from the pituitary gland. Okay, so in hyperthyroidism, the T3 and T4 levels rises in the body. Okay, so there are many reasons for hyperthyroidism. One is thyrotoxicosis. Okay, so it is also known as thyrotoxicosis, and we have many diseases which can cause, like there is Graves' disease, there is toxic multinodular goiter, and toxic adenoma. Okay, so this is a hypermetabolic clinical and biochemical state. Okay, and it is caused by excessive production of thyroid hormone. The condition is more frequent in females. It is seen more in females than that in males. Okay, and there is increase in both T3 and T4 levels, but the increase in T3 is more greater than T4. Okay, now etiopathogenesis, that is what are the causes? Okay, so hyperthyroidism, it is caused by many diseases, but the three most common are Graves' disease, diffuse toxic goiter, toxic multinodular goiter, and toxic adenoma. Less frequent causes are hypersecretion of pituitary TSH by a pituitary tumor. Okay, so if there is a tumor in the pituitary gland, then it can cause more secretion of the TSH hormone, okay, which will stimulate the thyroid gland even more. Hypersecretion of TRH, which is the thyroid releasing hormone, okay, it can also be secreted in excess amount. And thyroiditis, which is inflammation of the thyroid gland, it can also cause this disease. Metastatic tumors of the thyroid, okay, if there is more thyroid tumors or there is metastatic tumor in the thyroid gland, it can also cause more release of this hormone, struma ovary, um, congenital hyperthyroidism. Okay, it is even seen congenital in newborn of mother with Graves' disease. Okay, HCG secreting tumors due to mild thyrotropic effects of HCG. Okay, example, HCG is human chorionic gonadotropin. Okay, this tumors can also cause mild thyrotropic effects. Okay, some examples are hydatiform mole, choriocarcinoma, and testicular tumor. And lastly, by excessive doses of thyroid hormones or iodine called jode-based disease. Okay, if there is excess iodine in the food the person is consuming, or due to any medicines also, it can also cause these issues. Okay. Now, what are its clinical features? Okay, so the thyroid hormone is mostly responsible to uh, control your body's metabolism, the basal metabolic rate, and it is responsible for many other functions like your growth and also to maintain the proper weight And apart from that, also for proper development in the small children, newborn, infants, everyone. Okay. So the clinical features which we see in hyperthyroidism, it includes a vast differences and vast variety of this we can see here. Clinical features we can see. Okay. So patients with hyperthyroidism have a slow and insidious onset, varying in severity from case to case. Okay. In every person, there will be difference in severity and difference in symptoms. Okay. Some people may experience some symptoms very mildly. They will not have much issues due to that. But in some patients, they can see more grave symptoms and it can cause them high discomfort, okay, and even can affect the daily activities, okay. So it starts in a slow manner and then it progresses. The usual symptoms are emotional instability, nervousness, palpitation, fatigue, weight loss in spite of good appetite, heat intolerance, perspiration, menstrual disturbances, and fine tremors of the outstretched hand. Okay, so because the thyroid hormone is increasing in the body, there will be instability. The person will feel more palpitations because even it affects the heart rate. Then the person will be nervous. He will experience more fatigue and weight loss. Okay, because when this hormone works much more than required, then it can also cause greater metabolism, which will cause more weight loss, more digestion of carbohydrates, fat, and sometimes even protein from your body. Okay, so the person will lose a lot of weight and he will always be tired. Okay, he will not be able to tolerate heat. He will face heat intolerance and the body temperature of this person also increases due to this. He will have excessive perspiration, he will sweat a lot, and the thyroid hormone affects the menstrual cycle also. So there will be differences, disturbances in the menstrual cycle. Okay, and there will be tremors of the outstretched hand. Cardiac manifestations in the form of tachycardia, palpitations, and cardiomegaly are invariably present in hyperthyroidism. The skin of these patients is warm, moist, and flushed, okay? Because there is a rise in temperature, there will be sweating, the skin will become warm, moist, and it will be flushed. Weakness of skeletal muscles and osteoporosis are common, okay, due to the excessive action of the hormone. The muscles will also get metabolized, and due to this, there will be weakness in the muscles, and then osteoporosis, even the bones become weak. There is more metabolism, which will cause the weakening of the bones. Typical eye changes in the form of exophthalmos are a common feature in Graves' disease. Okay, exophthalmos is a condition in which the eye bulges out because there is a swelling in the optical muscles. Okay, so this will cause exophthalmos and the eye will bulge out more. Okay, serum levels of T3 and T4 are elevated, but TSH secretion is usually inhibited. A sudden spurt in the severity of hyperthyroidism turned thyroid storm or thyroid crisis may occur in patients who have undergone subtotal thyroidectomy before adequate control of hyperthyroid state or in a hyperthyroid patient under acute stress, trauma, and with severe infection. Okay. There can be a sudden spurt or sudden increase in severity of hyperthyroidism if which is known as thyroid storm or thyroid crisis if the patient has undergone some type of surgery like subtotal thyroidectomy, in which a part of the thyroid will be removed, okay, before the adequate control of hyperthyroid state or in a hyperthyroid patient under acute stress trauma or with infection, okay. These patients develop high-grade fever, tachycardia, cardiac arrhythmias, and coma, and may die of congestive heart failure or hyperpyria. So, hypothyroidism, okay. In hypothyroidism, there will be symptoms which are very much different than hyper, okay, because in hyper there is greater release of T3 and T4. Here it is the opposite, there is less release of those hormones, okay. It is a hypometabolic clinical state resulting from inadequate production of thyroid hormones for prolonged periods or rarely from resistance of the peripheral tissues to the effects of thyroid hormones, okay. It can also happen that the Hormone is released adequately, but the tissues, they are not absorbing the hormone, not letting it act on them, and they are giving some type of resistance. The clinical manifestations of hypothyroidism, depending upon the age at the onset of disorder, are divided into two forms. Okay, the manifestations of this can be seen differently in different ages. Okay, there are two forms. First, we have cretinism or congenital hypothyroidism, which is the development of severe hypothyroidism during infancy and childhood. Okay, and second is mixed edema, which is seen in adults. Okay, so first is a cretinism. Cretin is a child with severe hypothyroidism present at birth or developing within first 2 years of postnatal life. This is the period when brain development is taking place. In the absence of treatment, the child is both physically and mentally retarded. The word cretin is derived from French, meaning Christ-like, because the children are so mentally retarded that they are incapable of committing sin. Okay, so what is a cretin? He is a child who has severe hypothyroidism when they are present at birth or when during the first 2 years of postnatal life. Okay, this is the period when the brain development is happening. So, if in this period the thyroid hormone is not working properly, then the child can have physical and mental challenges and they can become retarded. Okay, so the word cretin, it is derived from French, in which the meaning is Christ-like, because these children, they are very much retarded and they are incapable of doing anything wrong. Okay, this is the belief. So, what are the causes? The causes of congenital hypothyroidism, they are as follows. Developmental anomalies, example, thyroid agenesis and ectopic thyroid. Okay, that is, there is some problem in the thyroid gland formation. Okay, or the thyroid hormones are not formed properly, or there is ectopic thyroid. Genetic defect in thyroid hormone synthesis, example, defect in iodine trapping, oxidation, iodination, coupling, and thyroglobulin synthesis. Okay, any problems in the cycle of the thyroid hormone formation, like if iodine is not trapped effectively, there is no proper oxidation. Okay, so this will cause hypothyroidism. Okay, then fetal exposure to iodides and antithyroid drugs. Okay, many of the mothers, they may have such drugs during their pregnancy if they have thyroid issues, okay, or any other disease. If they consume any drugs in this time, which can cause anti-thyroid effects, okay, this can cause hypothyroidism in the child. Endemic cretinism in regions with endemic goiter due to dietary lack of iodine. Okay, so earlier in even in our country there was hypothyroidism in some regions. Okay, so it was called endemic cretinism in this region, wherever the children had more chances of having congenital hypothyroidism. Okay, so there was lack of iodine in the diet. This, which was the reason for causing such problems there. And this was mostly seen in the regions which are hilly, because the hilly salts, the salts found there, which are the rock salts and everything, they do not have iodine content in them. Okay, so the government made it a rule to add iodine to the salts. So whatever salts are available nowadays, all of them have iodine. Okay, and even the food, the region, everything did not have iodine in the people who live in the hilly regions. On the opposite side, the people who live in the plains, they get iodine from many of the foodstuffs, and even the climate is different there. So many factors are responsible for iodine absorption. Okay. So sporadic cretinism, on the other hand, is due to developmental anomalies and genetic defects in thyroid hormone synthesis described above. Okay.